Are you struggling with tinnitus and wondering why some treatments just don't seem to work? The answer might lie in the way your brain and ears are communicating or not communicating. Discover how a comprehensive approach can make all the difference. When it comes to treating tinnitus, there's no one-size-fits-all solution. Over my years of experience with tinnitus patients, I've learned that addressing hearing loss is crucial to calming the hyperactive neurons in the brain that contribute to tinnitus. If there's missing auditory input due to hearing damage, restoring that input is essential. This is typically done through low-level amplification with hearing devices. But that's only part of the solution. Amplification alone only fully helps about 50% of patients. To really make a difference, we pair it with prescriptive sound therapy and educational counseling known as tinnitus retraining therapy, or TRT. Sound therapy provides a soothing distraction that helps calm the nervous system, while prescriptive means the sound therapy is customized to your hearing profile. Today's technology even allows us to combine amplification and sound therapy in one device, targeting both stimulation and soothing of the nervous system. But we don't stop there. The emotional and cognitive aspects of tinnitus are just as important. By incorporating cognitive behavioral therapy, or CBT, principles into our TRT counseling, we help patients manage their thoughts and beliefs about tinnitus, ensuring the brain's higher functions support rather than sabotage the retraining process. At Sound Relief, we've developed a protocol that integrates all these elements: hearing restoration, sound therapy, and cognitive restructuring tailored to each individual's needs. It may sound complex, but when patients follow our guidance, the success rate is impressively high. I appreciate you taking the time to listen. If this sounds like something you want to pursue, give us a call or watch more of our videos to learn about how Sound Relief can help you. Thank you, and be well.